start recording. So just a reminder to either mute yourselves or and this is very informal always. So anybody that wants to ask a question, feel free to unmute yourself and ask a question or make a comment or type something in the chat box. But I am actually going to minimize our little screen here. Petra, you can see if somebody, it'll pop up. And I'm going to hand it over to Petra Colindres, the Assistant Director of our Breastfeeding Resource Center.
Hi, everyone. I'm sure you might have heard me talk once or twice, but like Vicki said, I'm her right-hand woman on most things, but we'll be talking a little bit. Me and actually Sarah, our admin, who I tried to wring her arm to do this webinar today, but we really worked hard to do a new and updated breastfeeding website, so Oklahoma Breastfeeding Resource Center website. So we're really excited to kind of show you what we've been working on. And without further ado, I'd like to start with a couple of announcements, and then we'll show you all the great resources you guys have at your fingertips. Also, too, we want to utilize this time as sort of a feedback. So if you have any suggestions or you love the website, hate the website, maybe you have a different, we'd love to hear your opinion. This website is for you guys. So even if you have people you want, maybe even want to share the link to and just kind of get some feedback. As you all probably know, websites are, they're a never ending project. There's always something to add to them. So we would love to get your feedback, now or later or anytime really. Let me see if I am smart enough to make this work. So as always, we don't have a financial interest or anything like that, affiliation with any organizations. So we're not getting paid to give this presentation today. Again, here's our OBRC team. I just like to introduce, again, sometimes you don't know, everyone knows Becky is, but maybe you don't know who I am. I'm the person in the purple right after her. Sarah Bellotti is our admin who also worked really hard on the website. And then we do have Amanda Parsons. You probably will never hear her on a webinar, but she's part of our team and works on our outpatient clinic here in OU. So we like to include her as well because she's an important team player. So as we kind of go through getting the announcements out of the way, we all want to wish everyone Happy New Year, Happy 2019. Hope that cloud is kind of getting out of getting out through the New Year fog. It's the first week or two. One thing we do really want to push, if you guys have not heard on social media or through email or anything like that, we have a breastfeeding hotline survey. Our goal or the purpose of this is to define needs of our Oklahoma mothers and families. How can we better utilize the hotline to meet these families and these moms where they're at? As you guys probably hear, there's maternity deserts. There's a lot of, like 77, I think, in Oklahoma now. There's just a lack of providers. So one of our really great ways that we can utilize care is through the hotline. And we want to make sure it's being used efficiently and that people are correctly and that people are actually caring about it. So I do have the link located here. It's linked, but also here's the URL. If you guys can answer it yourself or anyone else, if you know moms, and we say past, future, present moms, so it doesn't even have to be someone that has a kid right now but may eventually have a kid in Oklahoma, we want to hear from you. We want to know how we can actually make the hotline work for you. So it will close end of this month, but there's still a couple of weeks and we would love to get more responses so we just adequately have a good segment of the entire population of Oklahoma as best as possible. So, a couple of fun things. January is Martin Luther King Day, as you guys probably know. It's National Bath Safety Month. I just thought that was kind of important for our little babies, just making sure that we're bathing them correctly, just so kind of something to be aware of. And then National Blood Donor Month. I'm sure you guys working in the hospital have probably seen a lot of blood drives and things of that nature. So it's an important month for many things. Well, another event that we have, what we talked about last time, is our Strong and Healthy Families Expo. It's for everybody to come to. If you're in the Oklahoma City area, probably easier for you to get to, but of course, the whole state is invited. But it's on Friday, January 18th, 2019. It's from 10 a.m. to 2 p.m. It's at the Children's Hospital Atrium at OU Medical Center, and we will be celebrating 10 years of the Oklahoma Breastfeeding Hotline. So we're really excited to be a part of this event. We will have, wellness exams, a farmer's market, there's games, we're making it fun, so it's going to be like a birthday party, but we did want to have those wellness wellness events as well. So again, free screenings, free eye checks. Our clinics will be there. I hear that the pediatrics team, the pediatric surgeon chain, actually give little tiny casts on little kids' fingers. Their finger casts. Thank you, Becky. It's super cute. So we'll be having some of that. It will help families, and we'll be celebrating the 10 years of the Oklahoma Breastfeeding Hotline. And Becky will be giving a great speech, and our hotline members will actually be there so you can meet the lactation consultants. More announcements. So we have the grad opening of the Coba's Baby Cafe that's happening on the February 2nd on Saturday. It's going to be at the Cole Community Event Center, and we will be sending out more details. We hope that you and your families can join. We do have a new event calendar for COBA, and it's at okbreastfeeding.org. And of course, let COBA know about your breastfeeding related event, or if you want any updates from COBA, please feel free to email them to get those updates. Announcing some of Becky's or our OBRC's educational opportunities. We do have 2-day trainings for breastfeeding basics and beyond. We have one in Oklahoma City and one in Tulsa in March and June. So if you are interested in that, please email us. We also have a couple of 1-day trainings coming up, making breastfeeding easier. We have one end of this month on the 31st, the 25th of April, July, and October, and they're all going to be at Sam's Education Center here at Oklahoma City. And again, we could always have these come to your location as well. So if you would like a 1-day or 2-day training, please let us know. We're also still have our 15-hour online breastfeeding training for healthcare staff. So if you guys are interested, please sign us up, or have any staff that want to sign up, please let us know. And again, just an announcement, we're no longer offering BSEP courses or materials, just so you guys are aware of that. And of course, our big event of the year, we're really excited about it. Our Save the Date Summit is coming up on February 22nd. We'll have Joan Meek and Kathy Carruthers. And Joan Meek is out in Florida, and she's a pediatrician. She's AAP chair of breastfeeding. And we'll talking about why do we still need to make the case for breastfeeding and the breastfeeding friendly practice. And we'll also, Kathy Carruthers will talk about building connections with clients and colleagues and how mother knows best. And one of the last things I want to talk about is our social media. So if you guys are not already following us, please follow us on social media. It's such a great way to really connect with us, and also too for those younger moms, younger nursing staff, things of that nature. We all know that they like to be on their phones and looking at Facebook and Instagram nowadays. So we do have a Facebook page and we do have an Instagram page. And so we're really trying to promote it, get people involved. Again, just have that two-way communication and engagement. So if you all are interested, please follow us. So on Facebook, it's OK Breastfeeding Resource Center. And on Instagram, it's just Oklahoma Breastfeeding. Future BBF OK webinars. So you guys are aware, we have one. They're usually always the second Wednesday of every month, give or take. The next one coming up will be we won't have one because of the Baby Friendly Summit. But March 31st or March 13th, we will be doing the evidence behind baby-friendly steps 7 and 8. And April 10th, we'll talk about our update on online training for healthcare professionals. We're really excited to really roll out some new changes to make these more applicable and easier for your staff to really learn breastfeeding on the go. So we're really excited to kind of talk about that in the future. So without further ado, let me get our brand new website up. Da, da, da. We should have trumpets playing and all of this. So again, I want to do a little shout out to our admin who's sitting here, Sarah, because she worked really hard on this. Bless her heart. So, she did really great. And so we're going to kind of go through, delve into really where it could be important for you guys to really be aware of what we're doing. And I might glaze over some of the other things that are not nearly as important. So
Sarah, tell us how long have you been working on this website?
For an eternity.
How many months?
4, 6. I've lost count. Definitely since the summer, if not before that.
So at least 6 months.
Yeah, at least 6 months.
Yeah. So she's been amazing. She did not know she was a webmaster, and now she can put that on her resume. So we're really grateful for all the work she put into this, because we all know, if you've ever done any back end on website development, it's not easy. So we're really excited.
Just the disclaimer, we've been moving things and not everything's going to work right now.
Yeah. So if you guys didn't hear that, Sarah did have a disclaimer that we're still working on, it's about 92% finished, but like I said, websites are always a work in progress. So some things will still need to be updated, links and things of that nature. So if you're going through our website and you notice these things, please shout out to us so we can just make sure that they're linked properly and things of that nature. We do try to check, but some things fall through the cracks, unfortunately. So first thing to note is that we will actually have a new URL. It's going to be obrc.ouhsc.edu. That is not to say that our old one will not work. It still will, but it will eventually transition to this being the sole URL. And right now, the old one will eventually direct to this page. So, it used to be ouhsc.edu/breastfeeding, and that is no longer. It's going to be obrc.ouhsc.edu. So some of the big changes, first of all, it's cleaner, which is exciting. But we really, we have more information and we try to make it more usable. We are a resource center, and one of the more difficult things that we had to do is how do we arrange resources for you guys so you'll actually utilize them? As you know, it's really easy for things to kind of get lost in the matrix on sites. And so that was our biggest thing is, man, we have such great resources. How do we really make them usable for you? So as part of the baby-friendly journey, I think what we're really going to concentrate today are on our 2 tabs, are the baby-friendly hospitals and resources, and again, probably events and training as well. But, the kind of as we go through it, you will go through all the tabs, but I'm going to spend my majority of my time right there. Something to note right away that we have are these kind of big buckets right here. So we have one for healthcare trainings, one for families, and one's for handout on policies. So what these are made for is to kind of just direct you. Like if you're interested in healthcare trainings, you click here and automatically you should be able to go to our healthcare training page right there. So which is pretty great. The opposite is true as well. We try to really figure out where would families want to, if a family is coming here, where would they want to go? Well, obviously they're probably going to want to go to our resources for family page, but here we have all that information right here. And then also when we talk about handouts and policies, that again is really for your administration to kind of be like, okay, I want my nursing staff a little bit more resources. Where do we go? It takes us right to the resource page. So let me go through, let's start on the resources page. Let's start there. And also too, if you go down, I should finish the home page. We did talk about the Oklahoma Breastfeeding Resource Center, kind of talk about our mission statement. We do have our news and announcements right here along with our events. And then we do have a shout out to our partners on the bottom, which we're really excited because OBRC doesn't exist in a silo. We are blessed to be working with such great initiatives. And we really want to give them a little bit of hype down below because, again, we couldn't be what we are without them. So let me just scroll up to the top, and I'm going to go straight to, I'm debating, where do I want to go first? I'm going to go straight to the hardest page. I'm going to go to the resources page, and it's the hardest only because it has the most information. I think now we've actually organized it pretty well, so hopefully it's not very hard. It just has a lot of things for you guys to utilize. And if there's ever anything you see that is not on our page that you were really wanting to see on our page, please let us know. So first thing we want to say, it's resources by category. One of the first things we did do is actually divide everything into all the different steps. So we thought that would be the best way to organize since we are doing the Baby Friendly Hospital Initiative. They do have the 10 steps. So you should be able, if you needed something like, okay, I need step 2 for training the healthcare staff. What do we have there in a resource center? Well, if you click on it, first we try to have evidence-based research. So here's all the research that we have, why we should really be implementing step 2. If, in case anyone questions that, administration, patients, things of that nature, we're really trying to kind of do some up-to-date, quick research just so you can always have that on hand. Then, of course, we'll also have the education. So here we really go through the different educations that we provide. It's not always going to be us over here, but some, we have here from the department or Maryland department, Albany. We have a couple different locations, but again, we are trying to just give provider education. And so with provider education, what that means are those 3 hours that the Baby Friendly Hospital Initiative is now having the doctors have. Staff education, we still have our 15 hours online, and then this will be our April discussion is how we're moving to digital talk. Clinical skills and management, that really has to do with different things that your staff can use to make sure that they understand and how that breastfeeding is going well to utilize actually in the field. So for example, if you click on breastfeeding management, Sarah said it might not work right now, unfortunately. Okay, so we're not quite there yet, guys. But what's going to be there is it should, are they all not linked right now? Okay. Yeah. So we're in the process of updating all of our handouts from the old site to the new site. So that's going to take a little bit. But if you link on them, you should be able to see the algorithms, latch assessment. So things that actually your nursing staff can utilize in the field on the floor to help with breastfeeding development. And of course, too, we do have some videos on below. So a lot of these are going to be kind of organized the same way. I will say that we'll always have evidence-based research because, as we know, all the 10 steps have evidence-based research, but not every bucket will be the same. So if you go to policies, we have evidence-based research and sample policies. That being said, some of our steps might have some sample policies with it, but they might not, just depending on what resources we have. So everything will be a little bit different, but then still, again, it's still organized in a fashion that we hope makes sense to you guys. So are there any questions that you guys have thus far? It looks like no. Okay.
Not yet.
Oh, not yet.
Not yet. Okay. Sound, but I know sound is working. All right. Perfect. So going back through resources, we also do have all of our BBFOK webinars. So if you click on there, that'll take us immediately all to our webinars. And Sarah was great in actually dividing them all into different steps as well. So when you just click on that, you're like, man, I really want a BBFOK webinar about step 3. Perfect. You got it right there. So these are something, again, we're really working on to make it more streamlined and easier for you to share with, for you to find yourself, because I'm sure there's always sometimes you want to brush up on some information, but also to kind of give and distribute to those in need around your hospital. We also do have all of our patient handouts. You can actually click on them now, which you can actually see them, which is super exciting. And then we did divide them up into the different steps as well. So again, we're really trying to help you to have that information at your fingertips in an organization fashion that makes sense. So if you guys, take some time, click through the different tabs, we hope it makes sense. Again, too, we really do want your feedback. If you think something's on step 9, that should really be on step 10, which that'd be a real weird jump, but you never know. But please let us know, because, and sometimes too, one of the hard things with resources is they can belong in multiple locations. So, we're working really hard to make this as usable as possible for you. So please let us know. We also do have just an information bucket about the state of Oklahoma, where we talk about our CDC breastfeeding report card, the NPEAK stats, which I know you guys care about, especially at least once a year, you really care about them. And then how to find your hospital's NPEAK score. And then we do have some lactation rooms on Oklahoma City OU campus, just so people know where to find breastfeeding resources. And then last, we do have our hot topics. So, talk about marijuana use and breastfeeding, unexpected collapse of a healthy newborn. So these are going to be really those big questions that, they kind of trend, like Zika. I know we still have Zika on here, but that might be like, oh, can you smoke marijuana and breastfeed, things of that nature. If there's anything that comes out about it, we will put it underneath our hot topics page. And then, of course, we have all of our national organizations that support breastfeeding, and these will be actually linked to their pages where they talk about their support and how their policy statements about it. And then we have our breastfeeding friendly work sites. So that's really everything on the resources page. So what do you guys think thus far? Does this make sense to you? Does it seem cleaner? Just any feedback? So I guess I think that means you guys think it's amazing, right? It is perfect as it is.
I think it looks great. It's really easy to navigate. I love it.
Yay! That's what we want to hear.
Thank you.
Sorry, Sarah's asking questions, but well, I'm glad you're liking it.
Well, and then just to add in, the resource section is the one that we debated on the most as to how to arrange it. So that's why there's still parts of it that are kind of under construction, if you will. So we're definitely open to feedback. But,
the resources page probably take 3 months or 4 months by itself.
I know. There's so much that could go under that one. So.
Mm-hmm. Okay. So that's our hardest page, and this one will probably, unfortunately, Sarah, be ready for it, be a work in progress. There's always something new to add to it. So of course, if you guys ever see something that's not there or want something, please let us know, because that's what we're here for, to provide you guys support and resources. Okay. I'm going to jump right to the baby-friendly hospitals because, imagine that you guys are probably on that pathway. So this really talks about our baby-friendly hospital initiative becoming baby-friendly in Oklahoma. First, we do want to draw attention to this. These are actual quotes from mothers in Oklahoma. And so we're super excited that we could actually kind of pay attention or draw attention to what the baby-friendly initiative, what feedback we're getting. I know with some some campaigns that I'm not going to name. Sometimes the Baby Friendly Initiative gets a lot of negative feedback, but there's a lot more positive, and that's something that we will actually be addressing at the summit. So here it talks about the Baby Friendly Hospital Initiative, how it got started. And of course, you guys probably have these memorized in your head already, but the 10 steps to successful breastfeeding, just in case someone did not know what they are. It really quickly jumps to becoming baby friendly in Oklahoma. So, starting your journey with us is really easy. And here's the simple steps: how to participate, how to begin implementing, and then registering with Baby Friendly USA. All of this is just to help ease your transition or ease the hospital's journey into the Baby Friendly Oklahoma journey. And of course, we do want to talk about our benefits to joining. So again, you guys probably are aware of this: our webinars, our assistance and guidance, the discounted online training for staff. So all of these are available to those who are actually in our Becoming Baby Friendly initiative or project. And for those of you who aren't, or if you know hospitals that are thinking about them, you should send them to our page so they can see all the benefits. Right down here talks about our Becoming Baby Friendly webinars, which again, you guys are aware of because you're on one right now. And then our YouTube channel, which this will link right to our YouTube channel, which if you guys don't know, we do have a YouTube channel. We do. But you can see every webinar we've ever done. I'll let that take a second to load, and you can just write at your fingertips if you guys are ever wanting to. This talks a little bit about our 4D pathway to becoming baby friendly, and we are drawing attention to our lovely hospitals that have already gotten the designation, which we're really excited about. And then also kind of, you guys have seen this probably a million times as well, just the pathway that we take to get there. And at the bottom, we do have our buckets of information. So we have our subscribe to our newsletter, join our webinar mailing list, and also request more information about the Becoming Baby Friendly in Oklahoma project. You just click on it and we are ready to go and help you out there, bringing you to information and making it really easy for you. Here's our YouTube page in case you've never seen it. Has all of our breastfeeding resource center, but has all of our webinars that we've ever done. So just FYI, if you guys were not aware, and if you missed a really important one, or if you're having real problems implementing steps 1 and 2 and want some more information, right there. So I'm going to go from the baby friendly hospitals to events and training. This is going to be really important for you guys as well, so you know when our events and training are. Again, they're open to everyone in the BBFOK project. We can go to your hospital. We really want to push these because it's free, but I mean it's supported by the health, our state Oklahoma initiative. But also too, it just makes a lot of sense, especially if you're coming to the baby friendly hospital initiative, that your staff is going to need some training, and we all know that. So we offer these classes. Here is a full schedule of our upcoming events, and you can always view the full calendar. And again, something we're really drawing attention to is our upcoming 10th birthday party at the Family Expo, with our beautiful picture of that campus. Mm-hmm. And then also too, in our in-person classes. And what we're really excited about, first of all, we have really great names for our classes, mm-hmm. but beyond that too, is it really goes in and you can see the agenda. You can talk about like what are we going to talk about that day? Well, here we go. It will link up to there and give you all the agenda points. Here we go right here. Just in case someone's wondering, is this a good fit for me? Well, here's how to know if it is a good fit for you. Also too, perfect, thank you. Talks a little bit about the class, what we'll be talking about, and then this class also has 7.5 hours of nursing contact hours, which is always really exciting. And then breastfeeding basics and beyond, it is a 2-day training course, has 11.8 CEUs. Same idea. This class obviously goes a little bit more in depth than the single class, and you can see the agenda and all that fun stuff. Again, talking about how to book a session at your facility, and then talking a little bit about our online training for healthcare staff. And at the very bottom, we can always enroll. And again, too, we're re-listing our breastfeeding for providers education, since that's not a requirement, and then our 15 hours for online staff. And lastly, on the very bottom, it's talking about our lactation clinical rotations, talking what's actually available for events and training, since that is one of our missions, is to help train. So we do have a 1-week lactation rotation. It's for dietetic programs. We do have a pediatric resident lactation elective, which is 1 to 4 weeks. And then we always have volunteer opportunities at the milk bank, and we have that listed right here too, if you have anyone of interest who wants to learn more about breastfeeding. Talking about training, you might be like, well, wait a minute. I thought that OBRC has a Pathway 3 program. And you would be right. On our Become an IBCLC page, we talk all about, because we get so many questions. I don't know if you guys do as well. How do you become an international board certified lactation consultant? What goes into it? How do I get there? We tried to really, as much as possible, which I know there'll always be questions, but to kind of get over the basics on this page. So becoming and a lot of this, you guys might be already be IBCLC, so maybe a lot of this doesn't apply to you, but if you ever had someone asking you questions, if you don't have the time to really in-depthly answer them, if it's an email or something, please send them to our site. We really are trying to save you some time here. So it talks about, how you become one, the 3 different buckets you really have to fill, the general college education, the 90 hours of lactation specific education, and the 300 to 1,000 lactation specific clinical hours, depending on which pathway you choose. We link to the different, obviously, website and then reviewing the pathways. We also try to do a brief overview in our own words right here. Again, too, we offer a Pathway 3 program, so we really are going to put a little bit more information on that. So what we do is provide the clinical hours at a cost for those interested in becoming an IBCLC. More information here about our actual training, and then the application process is right here as well, which is really exciting. Apply now, they just click onto it, and then we're good to go. So if you guys ever have people interested in becoming an IBCLC or just have some questions, please lead them to our page now and tell them about the Become an IBCLC tab. I'm going to go. We have a baby snoring in the background. I'm going to jump over to the family. Well, I'm going to check to make sure there's no questions thus far. I doubt that there is. No, you guys are great today. Jumping over to the families tab. So this also, I think, is going to be really useful, especially if you do anything in outpatient. This whole tab is about what resources we have in Oklahoma for families. So let's talk about in-person help. Of course, we're going to talk about our OU Physicians Lactation Clinic. A little shout out for our for Variety Care. They're going to have a lactation clinic in Oklahoma City coming soon, so we're super excited about that. But then what about the whole, the women's, infant, and children? Because obviously WIC will help with breastfeeding. So you can click on the clinic list there and it will guide you to there if someone needed to know where their nearest WIC office is or something like that. And then we're going to also have the 2018 or 2019, I guess now, coming up, lactation consultant guide. So if someone needs to find a lactation consultant in their area, they can download that guide right off of our page, which I feel is really nice just because it makes sense where it's at. And a lot of times too, yes, we always kind of know where the big city help is, but sometimes when you get out in the more rural areas, it's a little bit harder. So that list is invaluable.
Petra, if I can, so just for those of you that might not be familiar with the lactation consultant guide, that's something that the State Health Department and WIC service maintain, and they update it every 6 months. Mm-hmm. And so if your hospital provides outpatient lactation services, take a look at that and make sure that you're listed. They do sometimes find it challenging trying to keep up with, the current contacts at each site, but you can find breastfeeding support groups. You can find who's maybe doing home visits for lactation. And then, of course, there's the hotline and so forth. And then who's providing outpatient services. So definitely check that out and contact. There'll be information in there about how to contact the health department to make sure you get listed. But they update twice a year.
And it is done regionally, which I love. It's all color coded. So Oklahoma is yellow, or Oklahoma City area is yellow. North Central is pink. So, if you just know, you can tell them, find the pink area, just depending on where, what they need. And it does talk about hospitals that are available for maternity care, as well as different classes, health departments, things of that nature. So let me go back to my tab. Oh, got to move this over. There we go. So back to the families tab. Sorry, guys. Here is a list of local breastfeeding support groups. If you guys know of a support group that we don't have up here, please let us know. Again, this is for our families, for you guys to help, kind of show off what you guys got going on. So this is what we know about right now, but if there's anything we forgot, please let us know. We will add you very quickly. And then, of course, we do have our other organizations, COBA, Thrive Mama, La Leche League of Oklahoma, that really do meet regularly. little link to our Facebook page. Again, a little shout out if you're not friends with us on Facebook, please like us. We have information about working and breastfeeding by the state health department, English and Spanish, how to use your hands, so hands-on pumping, and then also pump rental locations. Unfortunately, or fortunately, I mean, I think it's more of an unfortunately, that list has started to kind of shrink. I guess, closing of certain chains and things of that nature have led to that. But there are still areas that do want pumps and scales. So again, too, if you see something on that list that is not on that list, or somewhere that runs these things and are not on that list, please let us know, because we're trying to have as full of a list as possible. Again, too, WIC does do rentals depending on need if they qualify, and then the Medilla site to find rental base on your zip code. We do have the different organizations, so the Health Department, COBA, the Coalition of Oklahoma Breastfeeding Advocates, the Mother's Milk Bank, and the Lactation Center. And then we talk about the different services. And then we do, of course, have myths, questions, and rights. So what's in breast milk, common challenges. Again, too, we're just really trying to help mothers where they're at. So, what is a WIC breastfeeding peer counselor? They can click on that and just find out what those answers are. What's the myths about breastfeeding? They can just go ahead and click on that. And we just, again, trying to make this as easy as possible, except for right there. Of course, I'm going to pick the one that doesn't have anything. So again, too, guys, if you guys go to this website and just do that and notice something, please let us know.
Well, give me a month.
Yeah. But, unfortunately, as we rearrange, sometimes links don't stay linked. So this is the fun of building a website. We have everything for moms, just following websites that offer pregnancy information and breastfeeding advice. We do have an LGBTQ area, so if you have anyone that falls into that category, how we're offering them support. And then guides and toolkits, how to breastfeed a baby with Down syndrome, which that's a great toolkit right there. Breastfeeding basics, learn to start, overcome, and thrive your breastfeeding journey. The first 1,000 days, which that's just a whole organization that I'm kind of obsessed with. But a lot of different things on there that you can actually utilize, and not only for the initiation of breastfeeding, but throughout the whole breastfeeding relationship. Introduction of complementary foods, common times that babies regress, what are normal infant behavior at the different months. So just kind of knowing about that. We do have stuff for grandmas, dads, family members, how they play an important role. We do have some videos, again, too, how to tell if a baby has a good latch. Parents can read all they want, but a picture says 1,000 words, right? So we do have videos they can link to get more information. And then some information about donor milk, where it is, learn about it, how to, where they can get it, things of that nature. And it looks like no questions. We're doing good. Okay. Is this all making sense to you guys so far? I'm going to say that's probably a yes.
Yes.
Okay, perfect. Okay. Then I'm gonna do our breastfeeding. So our biggest tabs, you guys probably tell, are our family tabs and our resources tab. Just given the nature of the beast, it's gonna be a little bit bigger. I'm gonna go to our breastfeeding hotline, and then I'm gonna do save the best for last, or the easiest for last is our about page. So our breastfeeding hotline, again, just trying to draw more attention to our breastfeeding hotline. This again is going to be some real life stories about moms that have called, which is really exciting, like kind of their input, what they were worried about. Again, kind of bragging on our providers and on the hotline in general. We do have the hotline big and bold here. We have it big and bold here. We have it on the homepage. Again, we're just really trying to push mothers to the hotline. I think everyone's kind of struggling with this nowadays. People are trying to get information from Facebook, from social media, which sometimes is a great thing, but sometimes they're not getting the most accurate advice. So trying to, again, push them to a free professional is what we're really trying to do, so they don't get the wrong information for their situation. Healthcare is hard, just because though there are the bell curve or the average, a lot of these cases are specialized. So therefore we really want them to see a professional versus more of a layman, just so they make sure they're getting their advice. Now that doesn't count for support. Obviously lactation support, CLCs, everything like that is always needed to make support happen in the state of Oklahoma. So we do have in Spanish and in English. This does have, and we also have our flyers here too. So you can always download them if you want to help promote, and then talking about needing expert advice, where to go get that information. Becky, did you want to add anything about the hotline?
No, just a reminder. Thanks to the health department for funding it for the past 10 years.
Fair, yeah. Hence the birthday party, guys. You should try to make it if you can. And last but not least, this is the easiest page to work on. This is just about us. If you're ever wondering who we are, what our mission is, to improve breastfeeding outcomes through education, advocacy, I can't talk right now, advocacy, clinical care, and research, where we want to go. We have a Facebook page. We need to add our Instagram page. That actually, our Instagram page, let me talk about that. We just started it like this week, or this 2019. So we're excited to have one, but we'll be utilizing more. And then too, just finding out more about Becky, more about me, more about Sarah. You can just click, I'll do Sarah. You can click, find out information, see what she does. If you want to know anything about Sarah, she loves her 2 dogs, Sherlock and Watson. If you want to get in her good graces, just give her a corgi anything, you're good to go. But, kind of getting some names to faces. Again, too, pushing our Oklahoma breastfeeding hotline. And then just some general pictures that we've developed or taken over the years. This one's actually pretty recent. There's my baby there too. When we're for advocacy at the state capitol. Just fun little things, pasteurization of milk with a student, I believe, just so you know what we're doing. Let's close that up. This is our organizational chart. That looks really nice, Sarah. We have an organizational chart really, because sometimes even for us, we try to explain what we do and we just do so much. So it kind of shows everything that we do in one quick area, just in case you guys were ever wondering, this is what we do. And then talking about awards or professional presentations, books, book chapters, you'll see a lot of Becky's name. But we're really proud of what she's done to really support breastfeeding in America and across the country. So we're lucky to have her. But again, too, this is what, we're working on, and it's really exciting that we are kind of leading the charge in this direction. So with that, Becky, if you have anything else, or if you guys have any questions or anything, suggestions, anything like that, other than we need to make sure all the links are working.
Well, and just, I think, reiterating, like you said, that it is a work in progress. Yep. And every time we look at it, we're like, oh, maybe this should go here, or wait, we don't have this on there yet. Because just trying to reorganize a website has been massive.
It's not easy.
So,
especially our website.
Yeah. But we hope it'll be a lot more user friendly. And if there's things, absolutely, we want your input. Mm-hmm. So.
Do you guys think it's more user friendly? Are you liking the direction? Do you think that you can utilize this more in your different hospitals and locations?
Yes, definitely. This looks very helpful.
Okay, good. Yeah. All right. Well, I think that's really all that we have today. So maybe we'll give you a quick 20-minute lunch, or
yeah. But you didn't have any other slides. You did all the announcements.
We did all the announcements. Yeah, I just got that out of the way real quickly. Thanks, Ashley, for that. Absolutely, we're really excited. Mm-hmm. And again, too, if you have people that maybe weren't able to make the webinar today, just tell them, give them our new website and have them look at it. They can go anywhere and really kind of contact us on the site, and we'll get that information. If there's any changes or any wrong information, and thanks, Rena, looks good, yay. I put hearts and smiley faces in the text line here a little bit. But we really have been working hard on this. We actually honestly, Sarah's been working diligently on it for the past 6 months, but we started this process about a year before last summit. So it's been over a year actually in the making, and we're blessed with Sarah's patience to work on this, and we're really excited to provide it to you all, because we have such great things that we want everyone to be able to utilize in a manner that makes sense and is presented well, because if you can't find things, then it's hard to use them. So
we hope to see everybody at the summit.
Yes, we hope to see you all at the summit, and introduce yourselves now that you can go to our pages and look who we look like. Shake our hands. But thank you guys so much for attending the webinar today, and we hope that you have a fabulous Wednesday and a happy new year. It's 2019. The 2019's got to be a good year, right? Fingers crossed. Gotta be. So thank you guys so much. Thanks for attending.
Yes, thank you.
You're welcome. Bye.
Have a good day.
Close it up there. Yeah. And then it's the end meeting. And then just wait a second. Yeah.